This is A Drugless Life, podcast by Dr. Paul Bekkum and All Seasons Full Body Chiropractic Center, using alternative, complementary, and integrative medicine to help you live a drugless life. We get you back to doing what moves you.
Hey everybody. This week's episode of A Drugless Life, we are going to explore the topic of numbness and tingling in the legs and feet. And I've got Dr. Paul Bekkum with me. He is the expert in this area, and he's going to explain why. So Dr. Paul, why don't you share with us a little bit about why you wanted to explore this topic, numbness and tingling in legs and feet?
Well, I guess just lately we've had quite a few people now showing up that have peripheral neuropathy, whether that be from diabetes or a few of the patients coming in are some farmers that have probably been exposed to chemicals probably over a long period of time. Not necessarily was it just one single dose or anything like that. Patients with other types of infections that have ended up causing peripheral neuropathy, especially in their feet. We also have a lot of patients that come in that are having numbness and tingling in their legs and feet that is even stemming from a lower back condition where they're getting some impingement on a nerve root or something like that. So the big thing is a lot of these things are things that we just handle in the office every day. Are we going to be able to help all of them? No, but we can help, I would say, well over 90% of them. It's probably, high 90% range that we can help patients with, not only with, foot orthotics themselves, those are meant for supporting things, but also with, chiropractic treatment to look at joint alignment and range of motion, soft tissue treatments to help deal with myofascial trigger points or fibrotic adhesions that might be tethering to nerves or blood vessels that might be causing some of that numbness and tingling.
So you've got a special machine here that does some really in-depth testing for not only arch in your feet, and I'll let you explain that, but so we can get prescription type orthotics for people. And so what inspired you to make sure we had this because we provide this as a free service to all of our patients to go through the screening itself.
Yep.
What inspired you to want to have that as an option for your patients?
Well, one, just, literally having some problems with myself, not that I didn't necessarily have, numbness and tingling in my legs or feet. I guess I did on occasion have some issues with that, but just having some biomechanical issues with my feet and having to go through just multiple different doctors and getting just varied opinions from all of them, from almost in the typical medical profession, even going to podiatrists and really not getting any answers for what I had going on, to literally having different services done where you're getting your foot placed in a foam box and literally getting some kind of an orthotic made with the foam box there, and people not really knowing how to do that properly, and yes, they worked, but having to physically go through and look at the biomechanics of myself, and I guess with the training that I've had through the being a certified chiropractic extremity practitioner really helped kind of cement it in, because there's just a full class on just literally foot, gait, and orthotics, where we're looking at the mechanics of the feet and just making several different measurements here so that we can literally create a prescription orthotic, just like you'd get prescription glasses from an optometrist, so we can literally get a prescription orthotic that's going to match up with what a person needs. And if a person has something like neuropathy, we can do different accommodations so it makes the orthotics softer to walk on there, so you're not getting any pressure anywhere. We're not affecting any of the blood flow, because we definitely don't want to cause any issues. If a person has a diabetic neuropathy, they can't feel their feet. We don't want to cause any restrictions in blood flow, so they end up having circulatory issues. And I see patients all the time that have, actually I just saw a patient the other day, he's going to have a toe taken off because the circulation is just so bad that it's going to be better for him to have his toe taken off than having it gangrenous and really get an infection and the worst case scenario would possibly kill him, but hopefully he can get that resolved and kind of move on here. But
so is one of the first symptoms that people are going to notice when they're having, well, I suppose circulation problems, but also probably wearing the wrong shoes would be numbness and tingling in the legs? Or explain more about that.
Some people might come in, they do have pain and numbness and tingling in the feet. A lot of people might come in and actually they're coming in, they're complaining of knee pain, they're complaining of hip pain. And when you start to look at the body through the kinetic chain, and the kinetic chain is basically how your body moves and how your body's supported. Your feet are the foundation of your body's kinetic chain. It's just like the foundation of a house. If that foundation settles, what happens to all the doors and windows up above? They start to get hard to open and close, and pretty soon you can't open and close them. You can go and cut off all the doors and windows you want to get them to work better, but that's really not the root cause of the problem. The root cause of the problem is the foundation is settled in your house. I get a lot of people come in that have these odd symptoms. They've maybe even, hopefully they've actually come into us after they've been to other chiropractic providers or physical therapy, whomever. But once we sit down and look at their whole kinetic chain and find out, oh boy, they really do have some significant issues in their feet. And with that initial screening, it's a basic screening, but it literally gives us kind of 5 different points to kind of look at here on each foot. And if a person has more than 2 out of 5 things showing up on either foot, we really need to look at that a little bit further, do a little bit more detailed exam on them, find out exactly what they have going on, and see if prescription orthotic is something that they need, or if they can get by with just a generic off-the-shelf kind of an orthotic. So somebody's having symptoms. They're having knee pain, hip pain, numbness and tingling in legs and feet, things of that nature, and they've not tried or have been tested to see their gait and, their feet and if they've got the right shoes. What is the process in your office? What is the first step that you do with them? Is there a screening process or? Typically, almost everybody that comes into the office here, we're going to take them through kind of some initial screening tests. They're going to get done. There's 3 tests that we look at. One is just a functional movement screening that's going to look at your whole entire body and just how everything's moving. And it's also another test is a posture picture, so we can kind of even see just how your body's posture is being affected. That'll even just give me some keys into, okay, maybe we need to look at the feet here too. The other part of the screening test is a surface EMG test. Those 3 tests, the movement screen, the posture pictures, and the surface EMG give us a pretty good picture of neuromusculoskeletal-wise what's going on with the patient. I also do kind of a full kind of orthopedic muscle testing screen on people where we're looking at if there's any weaknesses showing up, and even especially with the feet. Are the feet showing anything where they're weak or not just functioning normally there? We're looking at range of motion and even individual joint movement. Each foot is pretty intricate. There's 26 bones in each foot, 33 different joints. So we need to make sure all of that is, aligned properly and moving properly, because if it isn't, if it's fixated, not moving properly, we need to get it adjusted so that it does move properly.
So you adjust their feet too.
So we adjust the feet during that exam. And literally if it's moving too much, that's definitely where we need to look at having an orthotic. So there's even some specific measurements where we measure some angles on people's feet where they should normally rest at. If they're not in that position, then we need to make some accommodations in an orthotic to help biomechanically get their foot to move in an appropriate way, especially when people are walking on hard, flat surfaces.
I wonder how many people have had their feet actually adjusted before. I don't know.
It's quite a high percentage here in the office, and
yeah,
I'm sure most
here
patients
it
would probably
is.
say that, but
yeah.
In the general public, it's probably a small percentage.
Because if you're saying that this is the base of your kinetic chain, it would only make sense that even if you're struggling up in the upper parts of your vertebrae, right, it might be a cause of something going on in your feet.
And I think, looking at the body from a kinetic chain standpoint, that also by looking at things more from a chiropractic standpoint, we're looking at neurologically, kind of from the brain and the spinal cord on down. We're getting a good picture. The brain and the spinal cord are the motor control. It's literally what is controlling how your body is moving. So we obviously need to have that working properly. It's like having wiring in your house kind of, blow a circuit or something like that. If something's not working, then your lights aren't going to turn on. Your sprinkler system's not going to turn on. Your oven won't turn on. Whatever, something's wrong here. We need to figure out what is going on.
And it's so interesting because, I fell on the ice this morning. We had the first major snowfall that we've had already at the beginning of October here. And I'm getting out of my car and you're pulling through. You see me fall on the ice. And I felt like I was fine. And then about an hour into it, it was interesting because even though I fell on my bottom, it was my neck that started hurting right away. It wasn't actually my lower back, which was interesting. And I was out of alignment. You checked me. I was out of alignment. But where the pain was coming from was my head and my neck. And
that gets to be just about the last part of your body that's going to move. That's where even patients that have auto accidents and stuff like that, that's why you get their jaw and their upper neck and all that are probably the worst areas affected, because that's where probably the most force is going into in a whiplash type injury.
So somebody could actually be having symptoms up in their head and their neck, and it's part of the bottom part of their kinetic chain. It could be their feet, and they're not even experiencing pain in their feet or their legs. And
especially people that are, like I say, on their feet for more than 3 hours out of a day. I mean, cashiers at different stores, they're standing there for an 8-hour shift. They might be on and off of them a little bit there, but if you're someone who's standing there for that long and you're starting to have aches and pains all over the place, for no reason whatsoever. You haven't lifted anything. All you've been doing is just standing there, checking people out. You're working at a restaurant, you work in a factory, and you're pretty much just standing in one spot. I mean, you can put down, some of the anti-fatigue mats, but sometimes those are too much. Sometimes they're not enough. But a lot of times, like I say, it gets down to the biomechanics of your feet, and I guarantee, like, if we make orthotics for you, they're going to work. If they don't work, bring the things back in. We'll make sure they get adjusted so that they literally will do what they should be doing here. I've had like 2 people ever bring them back. One, I knew she was going to bring it back. The other one was just an odd situation. But
so what happens if they're struggling with, they need foot orthotics, they've got an improper gait, and they don't get this checked out? What happens over time?
You're just starting to use the joints abnormally. I mean, that's where people start to end up getting osteoarthritis. Osteoarthritis is a wear and tear type of arthritis. It's because things aren't aligned properly. You don't have the proper range of motion. So now your body still wants to do its normal range of motion, but it's going to do it with the joints aligned abnormally. So what do? You wear the joints out prematurely. And that can happen if it's out a lot. You're going to notice it much sooner. If it's a long period of time, your body's really good at protecting itself here too. So it'll even shut off some of the signals after a while. It'll just allow you to keep functioning the way you're functioning there. And again, that's why we do that initial function screen, because we want to find out where you have the problems, that aren't working properly right away. Because if it's dysfunctional and non-painful, you know what? It's been there for a while.
Say that again. Okay.
So if a person comes in to the office, the screen helps pinpoint down where a person is not functioning correctly. If it's functioning normally and it's painful, those patients we can get cleared up fairly quickly because something's just getting stressed a little bit there. But if they come in and it's dysfunctional and painful, okay, it's now been there for a little while. But these people, after a while, will come into the office. I can think of patients maybe more in their 40s, 50s, 60s. They've had something for a while. It's dysfunctional, but it's not necessarily painful anymore.
They've had it for so long.
Because they've had it for so long, your body's adapted to it, and it shut down all those pain signals. You've maybe taken those pain medications, or maybe you continue to take those pain medications every single day because that's the only way you can get through the day. If you could just come in, get the screening done, we can find out exactly where you have the problems. There's so many people that we could help, and you can get off the medications. You can get back to moving and doing what you love to do without having that stress and abnormal range of motion and movement there, and we can accommodate for it. Some people might be worn out too far. If you just let it go, what is the typical scenario that you're going to get in the allopathic community, in the medical community? They're going to give you anything to kind of cover up the pain, the inflammation, the swelling, the muscle tension. All those is like a black piece of electrical tape that you're putting over a red warning light in your vehicle.
Was it you that I was talking? Maybe this is something that I heard somewhere else too, but I think it was something that I had heard somewhere else, but they talked about headaches and how this person was talking about people who describe their headaches as normal headaches. Well, there is no such thing as normal headaches.
I just had my normal daily headache.
Yeah.
There's no such thing as a normal daily headache. You shouldn't have any headaches at all, period.
Yeah. If you have a headache and you've had it for a long time, and I think that's where the dysfunctional no pain comes in. You've had it for so long, you're so used to it that you don't even know what it feels like not to have it. And that's where that dysfunctional no pain comes in.
Yeah, a lot of times we'll pick that up, especially in a person's neck. A lot of times it is related to some mechanical issues that are going on, possibly in their upper neck, possibly myofascial trigger point wise. But yeah, we're going to notice that they can't move their neck like they should.
And that's where that screening is so big, because you can see pictures of it and go, you might not be having pain here, but oh my gosh, look at what's going on.
The screening test, I mean, there's 14 things that we're looking at right away with people. Screening kind of your whole body and just how things are moving or not moving. And the sooner that we can get to things and get them back to functioning normally and being non-painful, wow. I mean, wouldn't somebody like to be able to do what they always thought they could do? I mean, yeah, there's people that it's gone way, way too far. And we still have patients that come in that have, severely affected, osteoarthritic joints, knees and hips and stuff like that. But if we can get it to function normally again, or as close as we can get it, you're going to be able to have something last longer. Might you possibly have to have a joint replacement down the line? Possibly. I can't say that we can, completely save people from, having a surgery or something like that. But if it's gone too far, it's gone too far.
That's got to be a rewarding experience for somebody to come in and think, they're going to have this pain for the rest of their life. They've come to terms with it, right? I've just come to terms with that. I'm going to just have this pain forever, and you're able to help them with that so they no longer have it, because they've already gone off the deep end, so to speak, as far as their acceptance of it.
There's way too many people that think there's just nothing that they can do to help out what they already have going on. And, even if they can just come in, most people, they're going to notice a difference within the first few treatments. They're going to see it even in the tests that we do. I mean, especially with the muscle strength test, we can literally show them if it's more a peripheral musculoskeletal problem, not a neurological kind of motor control type problem, although that can be affected significantly as well. But if it's more a hip, a knee, or whatever, if we do some of those muscle strength tests and it shows up as what most people would perceive as being a weak muscle, it's not necessarily that it's weak, it's more that it's inhibited. It's like a circuit breaker. Literally there's nerve end organs that go to your muscles and your tendons and all the ligaments that go around your joint, the joint capsule and the joint synovium itself on the ends of the bones. If any of that stuff gets irritated, it's like a circuit breaker. Your motor control, your nervous system will literally shut off those muscles so they don't irritate that. I mean, just think of if you get injured or something like that, let's go back, thousands of years here, and you're trying to escape a saber-toothed tiger or something like that, and you're running along, and all of a sudden, oh my goodness, you twist your ankle. What are you going to do? Your body's not going to use that, but you're going to hop along on the other leg, right? You're not going to hop on the leg that's injured. So your body's also going to kind of mask probably the pain at the time that you're in, so you can go find a cave or a rock to hide under or something like that, so that saber-toothed tiger can't get you, right?
I don't know if you'd want to hide under a rock.
I don't know if hiding under a rock, that's probably not a good thing, but
probably create more
maybe
pain.
You can jump in a river. I don't know, whatever. But you're not going to notice that pain until a little while later, and all of a sudden you're like, oh my goodness, that's when your body starts taking over and causes a lot of inflammation and all that sort of stuff. I mean, everybody knows when they have, an acute injury or something, it might take a little bit of time, but your body's really geared to getting yourself to a safe place before you literally get into too much more danger from that there. Maybe you might pass out, but I mean, your body's good at shutting itself down so it can kind of assess what's going on there and heal itself. So the subtle things are those chronic repetitive injuries that you just don't notice. I mean, it's like I say, standing around all day long. You got that numbness and tingling going down into your legs. It might not be something coming from your back. It might be a myofascial complaint issue there. Maybe you do have some diabetes. Maybe you do have some chemical exposure that's causing some of this numbness and tingling there.
Or if you're having trouble and every time you get out of your chair, your knee tweaks. It could be something as easy as going and getting some foot orthotics, getting your gait repaired, getting adjusted in the feet, getting adjusted in the lower extremities.
Getting everything lined back up where it should be out there, because your skeletal system is made to hold you up against gravity. I mean, if we didn't live on Earth, if we lived on the moon, our bodies would look completely different. Stay Puft Marshmallow Man comes to mind, but we won't go there. No. With no gravity there, you definitely wouldn't have as much bone density here, but obviously you live on Earth here. That's what's helping us hold ourselves up against gravity here. But, kind of getting back to the muscles there again, when those muscles are inhibited, you're just not going to function normally here. So patients coming in that are getting treated, if they do have a muscle that shows up kind of weak, we can go and literally, and for me, it helps me target down exactly what's causing the problem so I can get in there, get it treated. The nice part is that day, people are going to see, okay, usually if it's a musculoskeletal problem, we're going to have probably 90 to, I would say, people are probably 90 to 100% back, probably 99 to 100% back with the strength there right away, unless there's some significant inflammation going on. But it's a huge difference from what it was probably before we treated them to after we treat them. So they get to judge me. I always get to tell them see if I did a good job or not.
Yeah, and I love how you're starting to talk to people too about what are their functional goals, what is the vision that they want to create for themselves when they are repaired from this injury. Because I think a lot of times people, they get to this point where they stop getting excited about life because the pain kind of overtakes them. And when they can see that there is a future for them doing the things that they love to do, and having a conversation around those things, and that, yes, you can help, you can be that guide for them to help them heal, and allow them to do those things again, is just, it's rewarding, the mindset itself, just to know that they can start doing those things they thought they could never do before. Seeing you is just, kind of a rewarding thing, and, just helps with the mindset every time they come to see you. So,
well, I think the big thing is, unfortunately, people come in and they just have a little bit of a limited mindset when they come in because they've been dealing with this for such a long period of time. Pain is just like the tip of the iceberg. A tip of an iceberg can be, a tenth to maybe an eighth of the whole entire iceberg, but that's all they're seeing. Right. We're trying to dig down and find out, hey, what is that root cause of this pain or this problem here, so we can deal with that there.
Well, and they've been seeing Western medicine doctors for how long? Allopathic medicine doctors who are just covering up the problems, offering surgery, and they don't, a lot of times people don't know that there are other options out there. So,
and that's what we have to get out there. If you're kind of tired of just using that black piece of electrical tape to cover up that red warning light, because what's that going to do eventually down the way? You're going to wear that thing out. You do that to your engine in your car, what's going to happen here? The red, oil light went on. You can keep putting some black electrical tape over it for a long time. Doesn't mean that you don't need to put oil in your engine. What's going to happen if you don't have any oil in your engine? You can't replace your body. You can replace the engine in your car. But
so come before you get
once there's a red warning light going off, you need to get it checked out.
Yeah.
And even if you read the labels on most of these medications in the store, how long are you supposed to take them before you consult a physician? 2 weeks.
Yeah.
How many people are still taking vitamin I? I've had patients call it vitamin I, ibuprofen. Every day they're taking, 400, 800, 1200, 1600 milligrams
havoc
of
on the guts, big time.
Ibuprofen every single day.
Yeah.
Just because that's the only way they can get through the day. If that's what's going on, you need to stop, because yes, you're causing problems with your gastrointestinal tract, your liver. You are going to develop some long-term problems there. Just read the label on the bottle. If you want to dig a little further, do a little internet research there, and go out to their own websites there and find out exactly, what are the things that can kind of happen. I don't need to go into that, but, if you can get in here, we're going to try and deal with things without any drugs at all. People will be shocked. Most of the world does not use drugs like the United States use drugs here, and they're much more healthy than the United States population. I think we rank 37th or something like that of industrialized nations.
That's just embarrassing.
We're spending the most amount of money on drugs and surgery.
And then we're complaining about how much everything costs.
And we're just doing Band-Aid care. It's a lot of it is symptomatic. Some of it is dealing with issues, yes. I mean, there is places for medication. There is places for surgery. I mean, everything has its place, but you got to learn when you need to do what things here. And you should always try and treat a lot of things more on the natural end of the spectrum before you jump to any kind of medications or surgery then next. So
for people who want to get started in the process, they call your office. So I'll put the contact info below. If you've been listening to us for a while, you probably have that info. But I will put that in the comments section. And then when they come in for the first time, they, like you said, they do the screening. Yep,
they'll go through those initial 3 tests. They'll get screened out. Myself or one of the other doctors in the office here will sit down with you, kind of go over those results with you there. On that initial assessment then, if you're coming in for kind of the full evaluation, you'll get kind of that muscle testing screen. If x-rays are necessary, then we'll be taking x-rays with that as well. Typically we don't do that foot scan until usually the second visit that people come in, but whatever they have going on, we try and get that all addressed on that first initial visit there. And we're still going through initial screening tests even through the second and third visit with people here, just so we have a really good full handle on what's going on. And a lot of people are going to need a rehabilitation program where we need to put them on some exercises and all this as well. So that's going to be included as well. So if you need something to support you, like foot orthotics, that'll get addressed. If you need something like some rehabilitative exercises, we'll know that right on that first visit, because that's what that initial functional movement screening will tell us there. A lot of people will need corrective exercises. That'll come from the posture pictures that we have there. So I would like to call them kind of reverse postural exercises, because depending on how your body is shifted, we're going to give you some exercises to kind of help reverse the posture that your body's in currently. After that, we'll be screening you out with the muscle testing screen to find out not only maybe what spinal levels are involved, as in most chiropractic offices, but also screening out whether you have any other issues throughout the rest of the skeletal system. So we're not only just looking at the 24 bones of the spine, we're looking at all 212 bones of the whole entire skeletal system to make sure that we're getting them addressed and taken care of. Otherwise, you might have something hanging out there that never gets taken care of if we just look at it from a neurologic standpoint. We also want to look at it, like I say, through your whole kinetic chain there. So we should have almost everything covered there. And again, we have different therapies and modalities to deal with pain and exercise therapy there as well to get you back up to a full functional status so you can get on to doing what you love to do.
And hitting your goals. Hitting the vision that you have for your future.
When we literally do set up treatment plans there, we always, we're not setting up the treatment plan for us, we're setting up for you. Whatever you want to be able to do, what you love to do, that's how we're going to set up your treatment plan for you so we can get you back doing that.
All right. Well, thanks everybody for tuning in. That will conclude this week's episode of A Drugless Life. Until next time.
I hope what we talked about is helpful and you have a great day.
Thanks for listening to A Drugless Life. For further information or to set up an appointment, visit our website at drpaulbekkum.com or give us a call at 701-356-0016.